Hi, and welcome to the Healthy Mothers Workplace Coalition webinar. This will be very brief on how to fill out our assessment to win a Healthy Mothers Workplace Award and a little bit of background about the coalition and our goals. So my name is Julia Parrish, and I am the director of the coalition, which is a partnership between health organizations, government organizations, businesses, and nonprofits to try to promote healthy and equitable workplaces for new parents. More about who we are. Our membership includes organizations like the San Francisco Breastfeeding Coalition, the U.S. Department of Labor Women's Bureau, the U.S. Department of Health and Human Services, San Francisco Department of Health, and the Commission on Status of Women. And we're really proud that all of these different organizations and different agencies have come together to improve working conditions and health for new parents. And the idea is that each of these organizations in their own way recognizes the impact that policies have on both equity and health outcomes for employees. Ours is specifically on three kinds of policies related to lactation accommodation, pregnancy and parental leave, and work-family balance. And we've chosen these three categories because research and our coalition has found that they have a really profound impact on people's ability to both perform their jobs and meet their obligations at home and to their families. And disparities in these policies really affect both health outcomes and gender equity. Because around responsibilities and pregnancy accommodations that impact people's ability to do jobs and care for their families. What we've done is come together to create a self-assessment related to those three kinds of policies. Employers can fill out and basically declare workplace has policies that support those issues. And the way that you do that is by filling out the self-assessment, which is available on our website and which I'm going to go over later. But the self-assessment is essentially just a sheet of paper that has brought together these kinds of policies in a chart that allows you to compare and contrast the policies that your business may have in one place. In 2013, we had our very first award ceremony in our very first year of offering the awards, and we had a lot of winners that we're really, really excited about. One of the most exciting things about this is the variety of employers that applied for and received the awards. We had nonprofit organizations, private sector law firms, other private sector corporations and businesses, government agencies, and they ranged in size from very small, only 4 employees, to over 1,000 employees. It was wonderful because it shows that really these kinds of policies and solutions are accessible to all kinds of us, not just one kind of employer. And different businesses can approach these and find solutions in different ways. So we have retail, we have engineering firms, and all of them have been able to meet the goals of these policies in some way that works for their workforce and for their business at the same time. The employers all also recognize that it makes really good business sense to provide these kinds of policies because they find that they create happier employees, they improve retention, they can also decrease absenteeism because people are healthier. And so they've kind of made the first step towards the commitment of applying for and receiving this award, talking about these policies, and highlighting them in their own workplaces. And of course, award winners are eligible to apply year after year, and we encourage anybody who has won in the past to continue applying. Talk about the actual assessment and what that looks like, how an employer can fill in order to receive an award. Now I know why you want to do it, because you're an employer that really values health and equity in the workplace, and that these issues are important to elevate in the discussion of your workplace and make sure you're paying some attention to them. And there's a lot of different reasons that it really is beneficial to everyone, employer, employee, health, equity, to have kind of policy discussion. So this is an example example of what the award assessment looks like. This may be edited from year to year. In fact, this version is updated from the 2013 version because we've some changes in the laws. And see that there are three categories of policies. The first is pregnancy and parenting leave and accommodations, lactation accommodations, and work-family balance. Those are categories of policies, and we did our best to divide up the policies so they fit in one of those categories. And there's levels of award. There's bronze, silver, and gold. Really focuses not so much the level of award, but the fact that employers are talking about these things, they're trying to implement them, doing what they can in the various categories in various ways. So it's possible that some employees are at the gold level in lactation accommodations and at a different level, for example, in work-family balance. And that is great, and we really encourage people to fill out the assessment as accurately as they can, even if they have different award levels for different kinds of policies. In order to receive an award at any particular level, an employer actually has to meet those requirements for all three categories. So for example, to get a silver level award, the employer would have to be at the silver level in all three. So in pregnancy and parenting, in lactation accommodations, and in work-family balance. I would encourage everyone to fill out the level for the award because it's interesting and it's exciting for us to think about how things change over time. So we've actually had one employer move up a level, and we were able to track that, and they were able to track that for their own records. And the point is not so much which level that you're at, but really that the employer is showing that they have a commitment to be doing these things and to be talking about these issues with their employees, trying to make workable solutions for everyone. And one in fact is that the bronze level category generally tracks the legal requirements for San Francisco. It varies a tiny bit from employer to employer, but in general, most of these bronze categories are things that are required of employers anyway. And so the idea is that receiving a bronze level is great, and we love it. And most of our initial winners were at the bronze level, and that is commendable and something we really, really are proud of. And having conversations about these things that are requirements are really important because sometimes employees don't understand, for example, that they're entitled to lactation accommodations. And so we just want to encourage people to be thinking about these things, bringing them to the forefront. And the other I want to point out about the bronze level, that you'll see there's a line, kind of 2 dots down for employers with more than 50 employees. And that's a recognition of the fact that most employers with fewer than 50 employees don't have to give, aren't required legally to give 12 weeks of bonding leave, and that requirement does exist for larger employees. So we wanted to make sure we distinguished so that smaller employers can get a bronze level award if they're complying with their requirements, which are slightly different than the requirements for larger employers. The other thing I wanted to point out about this assessment is that if you have questions about whether your policy in these brief descriptions, please don't hesitate to ask, because the idea is really that the idea of the bubble is something that has been adopted in your workplace policy, even if it's not kind of the exact wording. So for example, I've had someone reach out to me asking about the way that their particular lactation space was set up and whether kind of that fit in with our silver level categories, because they don't locking doors, like locking with a key. And we were able to figure out that they had created a solution that essentially is the equivalent, and that they are providing a secure space where the woman who is pumping doesn't have to worry about anyone coming in, and she can totally relax and not be stressed out, which actually can increase her milk flow, which is important for many employees. So again, don't be discouraged if it feels technical or if you're not sure if you exactly fit in with any of these categories. And I would encourage you please to just reach out to us and ask us about it. Again, the goal of the coalition is to elevate these issues and try to address them as best as we can. We understand that employer situations are different, and the solutions that we come up with might be slightly different in different circumstances. Again, also really encourage you to think creatively about other ideas, particularly in our gold standard for work-family balance. We've suggested some really innovative policies, such as Babies at Work policy, which is a policy that allows workers to bring in their infants to work with them, or sized childcare, anything that can help out with these caregiving responsibilities, particularly for new parents, but for any kind of caregiving responsibility. So if you have employees that are taking care of elderly relatives and you provide some kind of service for that, whatever it is that you're doing for your employees, we really be able to recognize, because we know that many employers really value the contributions that their employees make and that they understand that they have obligations at home too. So think creative there and let us know what you're doing, and we're happy to for you and give it as an example. The final thing I wanted to point out about this is sometimes employers struggle and they want to do something that's on this chart, but they don't quite know how. Like, oh, I want to implement a lactation policy, but I don't have one. We have created a toolkit, which is available on our website, healthymothersworkplace.org, and includes sample policies for many of these things. So there's a document that's a sample breastfeeding policy that anyone is welcome to cut and paste and just plug their business or edit it as they need to. And we've created many of these sample policies in order to help leaders who want to implement these policies make it as easy as we possibly can. And we're, of course, happy to discuss any of that with you and provide any kind of technical assistance around any of these ideas and concepts. The second page of the assessment is just the opportunity for you to tell us who you are so that we can properly recognize you and all of the efforts that you've done to support your employees, and then a little bit of information about the kind of workplace you have. And that's really so that we can think about solutions that employers have already found in particular industries to these issues, because we know that you've been thinking of them, and we're really trying to create as large a database of ideas and solutions as we can for everyone. And there's the opportunity to nominate staff that's been really helpful in implementing these policies. So if there's somebody around your workplace who really helped create that lactation space and volunteered their time, they used their day to clean out the old file room, and it's an opportunity to recognize the contributions that staff member has made in creating the best workplace that you can possibly have for these folks. So now you know a little bit more about the assessment. It's not scary, we hope, seems, and if it is overwhelming, we're happy to help you with that. And applying is easy. You can download that assessment from our website. It's available right there in healthymothersworkplace.org, and then you email the completed assessment back. This year, 2014, it is due on August 20th, and the award ceremony will be in September. Subsequently have slightly different dates, but those will be clearly indicated on the assessment and on the website. So if any questions at all about the assessment, suggestions, or you need help filling it out, please email me at jarish@las-elc.org, and I am more than happy to collaborate with you on any of those things. Again, you're welcome to use the policies that are in our toolkit, and I'm happy to help you with ideas around any of the other things that maybe aren't included in the toolkit or that you need help adjusting. And again, this is really a recognition of employers who understand that these policies are important for their employees, for their business, for health, and for equity. And we just want to be able to highlight those of you who are really doing what you can supposed to do for your employees in those regards, and anything else that you're doing, we would love to hear about and help you promote. So if you have any questions, please don't hesitate to reach out. Again, my name is Julia, and my email address is here, jparish@las-elc.org. And there's always information available on our website, www.healthymothersworkplace.org. You are also able to reach out to our partners in the coalition at the San Francisco Department on Status of Women. We work in the Department of Health or any of our coalition organizations. And if you have any questions at any point, we would love to hear from you. And I just want to say thank you for tuning in to this brief overview of who Mothers Workplace Coalition is, what our goals are, and how you can have your workplace recognized for all of the wonderful things you're doing to support your parents, both mothers and fathers, and their of infants, the health of your employees, and equity at the workplace. The ways you can stay in touch is through our website, or you can like us on Facebook and follow us on Twitter. We are very excited to have you join our coalition or apply for an award.